experience feeling sad, hopeless, tired, irritable, empty, low self-esteem, loss of interest, poor concentration, and thoughts of dying or suicides? If you do, you're experiencing the signs of depression. According to the World Health Organization, it can affect adults, adolescents, and children. Depression is a serious mode of disorder that is harmful to your life, but it is also a treatable one. Today, I'm going to explain to you what is depression, the signs, symptoms, and patterns of depression, and the treatment and prevention needed for depression. So, what is depression? According to the National Institute of Mental Health, depression is a common but serious mode of disorder that causes severe symptoms that affects how you feel, how you think, and handle daily activities such as sleeping, eating, or working. Depression is also defined by the World Health Organization as a common illness worldwide, with an estimated 3.8% of the population affected, including 5.0% among adults and 5.7% among adults older than 60 years. Depression is different from usual mood fluctuation and short-lived emotional responses to challenges in everyday life. Depression may be dangerous to one's health, especially if it's persistent and has moderate or severe intensity. It can make individual who is affected suffer severely and perform poorly at job, at school, and in family. Depression can lead to suicide in the worst case scenario. The signs, symptoms, and patterns of depression. During a depressive episode, a person experiences these signs and symptoms of depression such as persistent sad, anxious or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and weight changes, thoughts of death or suicide attempt, aches or pains, headaches, cramps or digestive problem without a clear physical cause, and do not ease even with treatment. And during this depressive episode, a person experiences significant difficulty in personal, family, social, educational, occupational, and other important areas of functioning, and it can be categorized as mild, moderate, or severe depending on the number of severity of symptoms as well as the impact of individuals' functioning. There are different patterns of depression disorders, and these are single episode depressive disorder, which means the person's first and the only episode. Recurrent depressive disorder, which means the person has the history of at least 2 depressive episodes. And bipolar disorder, which is characterized by a moment of euphoria or irritation, increased activity of energy, and other symptoms such as increased talkativeness, racing thoughts, elevated self-esteem, decreased need for sleep, distractibility, and impulsive irresponsible behavior. The treatment and prevention needed. In treating depression, healthcare providers may offer psychological treatments such as behavioral activation, cognitive behavioral therapy, and interpersonal psychotherapy, as well as antidepressant medication such as selective serotonin reuptake inhibitors and tricyclic antidepressant, depending on the severity and patterns of depressive episodes over time. Bipolar disorder is treated with a variety of drugs. Healthcare professionals should consider the risks of antidepressant medication, their capacity to administer either intervention, and their patient choices. Individuals and group face-to-face psychological treatment offered by experts and supervised lay therapists are among the several therapies forms to choose. For moderate depression, antidepressants are not the primary line of therapy. They shouldn't be used to treat depression in children, not the first line of treatment in adolescents, among whom they should be used with extra caution. Moreover, depression results from the complex interaction of social, psychological, and biological factors. People who have experienced adversity in their lives, such as unemployment or traumatic experiences, are more prone to depression. Depression can aggravate an affected person's living condition and the depression itself by causing greater stress and dysfunctions. And in order to prevent depression, prevention programs establish effective community approach to prevent depression, including school-based programs to enhance the patterns of positive coping in children and adolescents. Intervention for parents of children with behavioral problems may reduce parental depressive symptoms and improve outcomes for their children. Exercise programs for older persons can also be effective in depression prevention. To conclude, depression is a serious condition that brought negative impact on one's life, which can lead to death if left untreated. And it is important for us, especially adults, to have knowledge and understanding about this illness for us to be able to avoid and prevent this problem. If you are suffering from any of these symptoms, it is important that you seek care right away so that you can be treated immediately and your condition will not worsen. Remember, depression is a serious illness. It is not a joke, so take care of your health, especially your mental aspect.